Today, we will discuss meningitis, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Meningitis is an infection that causes inflammation of the protective membranes covering the brain and spinal cord, called the meninges. It can be caused by viruses, bacteria, or fungi, with viral meningitis generally being less severe than bacterial meningitis. Symptoms to look for. If you think you might have meningitis, watch for these common symptoms. 1. Fever. A high temperature is often one of the first signs. 2. Headache. A severe headache that feels different from a normal one. 3. Stiff neck. Difficulty bending your neck forward or feeling pain when you try. 4. Nausea and vomiting. Feeling sick to your stomach or actually vomiting. 5. Sensitivity to light. Bright lights may hurt your eyes. 6. Confusion or trouble concentrating. Feeling disoriented or having difficulty focusing. 7. Rash. In some cases, especially with bacterial meningitis, a rash may appear. When to seek help. If you experience these symptoms, especially a combination of them, it's important to see a doctor right away. Meningitis can be serious, and prompt treatment is crucial. If you think someone has meningitis, here's what to do in simple steps. 1. Call for help. Get medical help immediately. Call emergency services or take them to the hospital. 2. Keep them comfortable. While waiting for help, make them as comfortable as possible. Help them lie down in a cool, quiet place. 3. Monitor symptoms. Keep an eye on their symptoms, like fever or confusion, and be ready to share this information with medical staff. 4. Don't give food or drink. Avoid giving them food or drink until they are seen by a doctor. 5. Stay calm. Reassure them and stay with them until help arrives. It's important to act quickly, as meningitis can be serious. In the hospital, here's what doctors and nurses typically do to treat someone with meningitis. 1. Check symptoms. They will ask about symptoms and do tests to confirm meningitis. 2. Take blood samples. They may take blood tests to find out what type of meningitis it is, bacterial or viral. Give medicine. If it's bacterial meningitis, they will give strong antibiotics through an IV, a tube into the vein. For viral meningitis, they may not use specific medicine, but they will provide care to help manage symptoms. 4. Monitor vital signs. They will keep checking things like temperature, heart rate, and breathing to make sure the patient is stable. 5. Provide fluids. They may give fluids through an IV to keep the patient hydrated. 6. Rest and recovery. The patient will need time to rest and recover, and medical staff will support them throughout the process. The goal is to treat the infection and help the patient feel better as soon as possible. Here are some commonly used medications for treating meningitis, depending on whether it's bacterial or viral. Bacterial meningitis. 1. Ceftriaxone, Rosvin, a broad-spectrum antibiotic often used for various bacterial infections. 2. Vancomycin, used to treat infections caused by certain resistant bacteria, especially Staphylococcus aureus. 3. Ampicillin, sometimes used for specific types of bacteria, especially in young children and older adults. Viral meningitis. There are usually no specific antiviral medications for viral meningitis, but supportive care is provided. In some cases, if caused by the herpes virus, acyclovir may be used. Note, the choice of medication will depend on the specific bacteria causing the infection and the patient's individual health needs. Always consult a healthcare professional for accurate diagnosis and treatment. Some groups of people are at a higher risk of developing meningitis. Here are those groups in simple terms. 1. Infants and young children. Babies and toddlers have immature immune systems, making them more vulnerable. 2. Teens and young adults. People in this age group, especially college students living in dorms, are at higher risk due to close living conditions. 3. People with weakened immune systems. Those with conditions like HIV/AIDS, diabetes, or who are on certain medications may be more likely to get meningitis. 4. People with certain medical conditions. Conditions like a recent head injury or surgery can increase risk. 5. Travelers. People traveling to certain parts of the world where meningitis is more common may be at risk. 6. Unvaccinated individuals. Not getting vaccines that protect against meningitis can increase risk, especially for children and teens. Being aware of these factors can help people take precautions to protect themselves. Now you need to watch my video on strokes or have a look at heart attacks.